I'm so excited to be here on this final day of SPR for a great week. So this year, we as prevention scientists are examining potential opportunities that are presented by big data in the world around us. During today's plenary session, we focus on the potential for mHealth to advance prevention science. Data in mHealth may be derived from any number of sources, including smartphones used to collect active or passive data, wearable sensors that can detect moments of stress, social media data that can reveal emerging trends in the nation. The goal of this plenary session is to showcase some of the uses of mHealth in prevention-related studies and to spark further discussion of the potential, the limitations, and the challenges that lie ahead. We're going to use the entire session for the plenary speakers, and I invite you to join us after lunch at 1 o'clock in Regency B, which I believe is right around the corner this way, to discuss the conversations today, the presentations today, and how mHealth could add potential value to more traditional prevention programming. So now it is my pleasure to introduce the three speakers. Our first will be Dr. Fiona Baker. She's the director of the Human Sleep Research Program at SRI International in Menlo Park, California. And she's honorary professorial research fellow in the Brain Function Research Group at the University of the Witwatersrand in Johannesburg, South Africa. Thank you. I didn't practice, clearly. She focuses on understanding the interplay between sleep physiology and human health across the lifespan, especially in women. Her current areas of research include interactions between brain development, sleep, and behaviors such as alcohol use across adolescence, and sleep in menopause. Dr. Baker is PI on two consortium projects about adolescent development, the National Consortium on Alcohol and Neurodevelopment in Adolescents, and the Adolescent Brain Cognitive Development, or ABCD study, as you might have heard of. Our second presenter will be Dr. Holly Jimison. She's professor of practice in both Department of Health Sciences and in the College of Computer and Information at Northeastern University. Dr. Jimison directs the Consortium on Technology for Proactive Care, which conducts research in the area of home monitoring of health behaviors, including helping researchers address the challenges of big data related to large amounts of complex and noisy streaming data from multiple sources used to infer clinically relevant health behaviors. Prior to joining Northeastern, she served as a technology advisor for the NIH Big Data Initiative for monitoring health behaviors at home and in the environment. Dr. Jimison's research includes work on tailoring interventions in cognitive exercise, physical exercise, socialization, and sleep management using new behavioral metrics derived from monitoring data. Our third and final plenary presenter this morning will be Dr. Nick Allen. He's the Ann Swindells Professor of Clinical Psychology at the University of Oregon and the director of the Center for Digital Mental Health. His work addresses biological and psychological risk factors for adolescent onset of mental health disorders, especially depression, suicide, and substance use. The ultimate aim of Nick's work is to inform innovative approaches to early intervention and prevention by utilizing this knowledge to generate and test novel, developmentally targeted clinical and public health interventions. This has included intervention studies focused on sleep, parenting, and teen sexual and romantic relationships. His work also focuses on using mobile and wearable devices to unobtrusively track and analyze behavior in order to detect mental health needs and provide adaptive, personalized interventions exactly when and where users need them. So I encourage you to enjoy this session, and we're very, very lucky to have these three join us. I think it's their first SPR for all three presenters, and they seem to have enjoyed their time here. So please come after lunch, engage them, ask your questions. And I also just want to thank my co-chair, Mike Mason, Big Data co-chair on the mobile health aspect, who's been really instrumental in organizing these sessions for us this year, and SPR for allowing us to entertain where mobile health and other types of big data fit in prevention science. So thank you. Fiona.